Well, really, it was a bit different trip in my life, in the meaning that when I ended up school, high school, at 18 years old, I didn't want to be a doctor. I was not projecting myself in that path. I wanted to understand how the brain functions. I wanted to understand how we think, how new thoughts appear in our mind, how we solve problems. So I just went in a journey with my father at that time, from one university to the other, checking the programs, the options, and then found nothing. I found any option that could be related to research in humans and brain and neurology or whatever, or neuroscience. There was not an option. There was something about animal research, which at that time I didn't find the common path to my own interests. So I finally ended up starting medicine, and I wanted to do some shorter career that could help me start working. So I went to in the Faculty of Medicine. We had some school for technicians. So I started medicine, and at the same time I started a short course for EG technician. I looked for shorter courses that may be related to neurology some way. So I started EG, and of course I was put inside the topic of epilepsy almost immediately, and it caught me. And then after I finished my MD studies, of course it was well known that I would study neurology, and from the very first day I went into the epilepsy clinic, which was the area with which I felt familiar. Going deeply into epilepsy allowed me to understand that it's really, as Penfield said, a window to understand brain function. So everything finally set up together there. So, well, as you may know, Uruguay is a small country in Latin America, very in the south. And of course, as a developing country, we have limitations, but we may also have some strengths. In the diagnostic aspects, nowadays we have good access to the standard diagnostic methods, including EG. We have a beautiful school of EG technicians. Nowadays, it is a university course of 4 years training. They are really very well trained in neurophysiology, not only EG. We have access to MRI, both in private and public systems. So basic evaluations for epilepsy patients are available. For those going into pre-surgical evaluation, SPECT, PET are available as well. So what I would say that we are a bit behind this in advanced diagnostic methods, just as post-processing of MRI or very high field machines, or genetics, autoimmune disease, for which we are usually sending specimens abroad. So that would be something to improve. From the treatment standpoint, our strength is that we have a healthcare system in which the available treatment is available to all. So both every pharmaceutical formulation available in the country is available and accessible for free for all patients from the public health system. Sometimes organizations cannot be perfect, but they have the access. And the same happens with epilepsy surgery. We have one epilepsy surgery program which serves all persons in our country for free, because it's supported by a governmental agency. So children, adults from private and public health services can go there and be evaluated, and if possible, operated on. Limitations are some advanced techniques for the most difficult to study patients, as invasive evaluations, which are not ready yet. We have some difficulties with equipment. Ketogenic therapy, it has been in the country for a while, but is not accessible, financially accessible yet for all the population. And then we are a bit back in the entry of some new medications in the country. Being a small market makes it a bit difficult to be a goal for some pharma business. So we expect that may change soon. Well, for my colleague neurologist, I would say that my research has been focused mostly on clinical evaluation, clinical assessment of patients, and in that sense I prompt you to trust yourself, trust your experience and your ability to go deep into the understanding of the patients you have, and with the clinical view we can really grasp some very relevant information for the management of the patients. In my case, I started with juvenile myoclonic epilepsy, and then over the years maybe went more on focal epilepsies because of working on epilepsy surgery. It doesn't matter. Whatever patients you have in front of you, each patient is a research project, going from diagnosis to the best treatment. I would say that what I can say in addition from my journey is that in the last years I may be more recognized for my actions on education rather than on research. Also I love research, but education is a big tool. And in Latin America we are improving a lot. We are really developing great strategies to involve everyone from every country in the different stages and depth of education. And I know that of course here in Europe and all over the world there are many facilities for getting trained at different levels, since the primary care to the higher level of epileptology. So then, whenever you have a patient or whenever you have a dream of getting better trained, just look around, get into the websites, and you will find your way, and we are here to work together to support anyway.